Good morning, everyone. My name is Stephanie Powell. I work as an occupational health specialist here at UAMS. One of my job duties requires me to orient new employees on the topic of blood-borne pathogens. That's the topic we're going to be discussing today. Before we get started, though, I would like to welcome you all to UAMS. I know that you will love working here just as much as I do. We are so glad that you have chosen to begin a career with us. During this presentation, we will define the term blood-borne pathogen. This includes discussing the types of pathogens and their routes of exposure. We will also discuss regulatory requirements like the Occupational Safety and Health Administration's Blood-Borne Pathogen Standard. Lastly, I will provide you with information on protecting yourself from exposure, recognizing potentially hazardous situations, and how you should respond safely. So what exactly is a blood-borne pathogen? Well, according to the Occupational Safety and Health Administration, further recognized as OSHA, a blood-borne pathogen is an infectious microorganism in human blood that can cause disease in humans. Think of them like a germ. They are able to spread from person to person with the potential to cause a lifelong illness. The most common and most dangerous blood-borne pathogens are hepatitis B, hepatitis C, and HIV. Let's talk about each one of these. Hepatitis B and C are diseases of the liver. The word hepatitis actually means inflammation of the liver. Hepatitis B ranges in severity from mild to chronic illness and can lead to liver cancer. With hepatitis C, there is a possibility of acute illness, but it often becomes a chronic condition. Hepatitis C can lead to cirrhosis of the liver as well as liver cancer. HIV stands for Human Immunodeficiency Virus. This virus affects the body long term. Once an individual is infected with HIV, it does not go away. HIV attacks the body's immune system, keeping it from being able to fight off infections and disease. Individuals with HIV are even more likely to develop cancer due to their weakened immune system. Without antiretroviral medication, HIV leads to the acquisition of AIDS. Now, does anyone know how these pathogens are transmitted? Well, surprisingly, transmission can occur from direct contact with the source or indirect contact. Direct contact occurs when the infected bodily fluid enters another individual's body. Take a look at Figure 3 on the left-hand side of the screen. This image shows direct contact transmission through the mucous membranes of the eye, nose, and mouth. This could occur from the splashing of blood or fluid onto the face. The image also shows direct contact through an open wound or needle stick injury. Indirect contact occurs when a person's skin touches an object that contains blood or bodily fluid. An example of this would be picking up linens that are soiled with an individual's blood or body fluid. Here's a list of all bodily fluids able to transmit infection. As you can see, most fluids that come from the human body can transmit disease. It's important to remember that many of these fluids are colorless. This prevents you from knowing if the soiled linen, for example, is wet because the patient spilled their water on it or because they spit on it. So how do we prevent being exposed? The golden rule of blood-borne pathogen exposure is to assume that everything is contaminated. We also want to follow OSHA's blood-borne pathogens standard, use universal precautions and personal protective equipment, enable engineering controls, and provide education and immunizations to staff. We're going to discuss each one of these in depth in the next few slides. All requirements of OSHA's blood-borne pathogen standard can be found in Title 29 of the Code of Federal Regulations. This standard serves as a guideline for employers to follow so that they are able to protect their workers from potential exposure. Here is a list of what this standard requires employers to do. As you can see, many of these requirements are things that we mentioned in an earlier slide on how to prevent exposure. One of the things we didn't discuss is establishing an exposure control plan. Each employer has a set of instructions for employees to follow in the event of an exposure. This plan should be updated annually to ensure that the information is accurate. Universal precautions are a must when it comes to blood-borne pathogens. Here we are again with our golden rule. Consider it contaminated. Universal precautions provide a barrier between potentially infectious fluids and/or material and you. Without that barrier, your risk of becoming infected increases tremendously. It's also important to remember to remove and dispose of PPE appropriately. We will discuss this further in the coming slides. After removing gloves, make sure to thoroughly wash your hands with soap and water. If you're unable to do so, use an alcohol-based hand sanitizer if your hands are not visibly soiled. Lastly, if an individual has a minor wound, it's okay to teach that person to apply a bandage to themselves. This keeps you from making direct or indirect contact with a potential pathogen. When you think of personal protective equipment, most think of gloves, gowns, and masks. Also important, though, are face shields, goggles, and barriers for mouth-to-mouth resuscitation. Do you know what's more important than just having the correct PPE available? Donning and doffing your PPE correctly. Take a look at Figure 5. When donning or putting on your PPE, start first by washing your hands. You then put on your gown, mask, and eye protection. Lastly, you put on your gloves. This keeps you from getting your gloves contaminated prior to interacting with the patient. When doffing or taking off your PPE, always start with your gloves first. This is because your gloves are potentially the most contaminated. You then remove your eye protection, gown, and mask. Lastly, you wash your hands thoroughly. When you do not follow these steps as they're listed above, you increase your chances of being exposed to a blood-borne pathogen. In the previous slide, we discussed removing your gloves. However, we did not discuss the importance of removing gloves properly and safely. Figure 6 shows this process in detail. When removing the first glove, pinch the outside of the glove near the wrist by pulling it downward and inside out. While holding the inside-out glove in the gloved hand, slide 2 fingers under the cuff of the remaining glove. Now be careful when you do that, not to touch the outer surface of the glove. Peel that glove downward while turning it inside out as well. Then dispose of the gloves in the appropriate receptacle. Engineering controls help to isolate blood-borne pathogen hazards. These controls are put in place to protect employees from potential exposure. Some examples of engineering controls are biohazard labels, sharps containers, safety needles, cones to indicate a spill, and cleanup items like tongs, pans, and brooms. These cleanup items prevent an individual from coming into direct contact with the hazardous material. Now that you're aware of what engineering controls are, I bet you can think of some examples from your previous place of employment that fit into this description. I like to say that education is key in all aspects of healthcare. But isn't that true with life in general? Being knowledgeable helps individuals be prepared for everyday life. Here at UAMS, we require employees to participate in annual training programs. That program serves as a refresher for important topics like this one. As human beings, we sometimes become complacent. Our annual education trainings help to refresh your memory on exposure prevention, your role in prevention, and what to do if you're exposed. We also require that employees complete the hepatitis B vaccine series. This is a series of 3 immunizations that is given over a 6-month period. This vaccine series can help prevent hepatitis B. Now, how do we recognize and respond to potentially hazardous situations? First and foremost, be observant. Look for obvious signs that a situation could be dangerous. Things like not having a sharps container in the room or not having a biohazard container labeled. These are potentially hazardous. Make sure that your PPE is readily accessible. You never know when you might need to put that on. When donning your PPE, take the time to apply it correctly and in the right sequence. The same applies when you are removing PPE. Again, if you follow the rule that everything is contaminated, you are further protecting yourself. So what happens if you're exposed to a potential blood-borne pathogen? This would never happen, right? Wrong. Accidents happen every day. You need to be prepared for the accident just in case. The first thing you want to do is wash the area thoroughly with soap and water. If you are splashed in the eye, irrigate your eyes with clean water or saline. Some work areas may even have an emergency eye wash station readily available. Be sure to ask your supervisor if you have one. You also want to report the incident to your supervisor immediately. These situations are extremely important. It's imperative that your supervisor is made aware so that the appropriate follow-up care can be determined. I know this was quite a bit of information, so let's summarize. When it comes to blood-borne pathogens, use universal precautions on each individual you encounter. Learn the steps to don and doff your PPE safely. Be wise and immunize for the hepatitis B vaccine, and remember to report any exposure to your supervisor immediately. The next 2 slides list the references that I used for this presentation. Now if you have any questions, I'd be glad to answer those. Thank you.